The ICU Patient and Family Support Program is made up of a team of social workers that's available to provide emotional support for the patient as well as their loved ones and family members in the ICU as well as after the ICU. It helps with communication with your treatment team, as well as the ability to provide the emotional support in the ICU as well as after.
The social workers on our team will check in to screen for mental health conditions like anxiety, depression, and acute stress. We do education, we provide community resources, and continue to be a support as you continue to recover.
The program aids in a patient recovery by being able to support the family so they can support their loved one. And then after the ICU, typically when a patient's more emotionally ready and physically healed, we're able to work with them to provide the support on their emotional journey as well.
I like to say trauma is a team sport, and it starts from the pre-hospital phase through the emergency department care, through potential surgeries, the critical illness phase or in the intensive care unit, the aftercare, and then the rehab. All those pieces have to work together to have the patients get the best outcome that they can achieve. Being a level 1 trauma center really ensures you have all those pieces in place. And a lot of our job is to orchestrate those pieces to make sure they all work together.
So the Trauma Survivors Network is a national organization. They provide support to patients that have had a traumatic accident or injury. They also support families. They have an online community where you can connect with other survivors to share hope, experience, connect with resources. We also have volunteers that are former trauma patients themselves. They volunteer on the unit and also after the hospital, and they can really be an inspiration, a motivation, and give you that continued hope and healing.
I look back at my experiences, and there's some patients who just have that will to survive, that will to succeed. It's often for a loved one, it's for their spouse, it's for their children, and they're just driven to get better, driven to recover, driven to be there for their family. Not everybody has that, and the family support team often is that link that really helps bring that out of all our patients, to give them, to show them, to give them something to work for.
I think patients in the ICU and families can feel isolated. They can be under a tremendous amount of stress, and to know that there's a team like us that can help them navigate the ICU, provide emotional support, counseling, and resources can really empower them to get through a very challenging time.
Being able to walk into someone's life when their world is pretty much shattered and being able to be that the hope or the strength that they need in that time to help them through sometimes one of the darkest times that they'll ever encounter.